So my presentation is a panel. It's with several other people from different disciplines, so it's a multidisciplinary panel about the treatment options for AML. So we start off with a patient case, and then we each go through our sections about treatment options and why we would choose one particular treatment option over another for this case. So I think what's really important now with AML, we've had 45 years of no major breakthroughs in terms of new agents, especially targeted agents. And I think that's not necessarily because we didn't know that we had specific mutations that were targetable. It's just we didn't have the molecules to use. So now, since 2018, now that we have so many more agents, I mean, we've had 7 approvals over the course of 2 years after a 45-year drought. So although it's very exciting, it also brings with it a lot of questions. So the questions that we as a panel try to answer in 2019 is, what are the options for intensive therapy? Should every patient get intensive chemotherapy? And then what are options for specific mutations such as FLT3, patients with core binding factors, IDH mutations? And then is there any role in the terms of sequencing? If one TKI fails, for example, can you use another one? Can you recapture that response? So there's really interesting questions that we as a panel try to discuss, and even though we may not have all the answers, at least to be able to discuss as it pertains to our patient case.